Have you ever noticed a stubborn wound on your leg that just won't heal? For many seniors, this isn't just a minor issue. It could be a venous ulcer, one of the most common types of chronic wounds affecting older adults in the United States. Venous ulcers develop when blood in the veins of the legs fails to circulate properly. Instead of flowing back to the heart, blood pools in the veins, increasing pressure on the vein walls. Over time, this pressure weakens the blood vessels, causing fluid to leak out and damage the surrounding tissues. The result is an open, slow-healing wound, typically appearing on the lower legs and ankles. According to the Centers for Disease Control and Prevention (CDC), more than 6.5 million Americans are dealing with chronic wounds, and a significant portion of these are venous ulcers. At first, these ulcers may seem small and painless, but without proper treatment, they can quickly become serious. Infection, severe pain, and even tissue death. These are the potential consequences of untreated venous ulcers. So, how can venous ulcers be treated safely and effectively? Simply covering them with a bandage is not enough. Proper care involves keeping the wound clean, regularly removing dead tissue, a process known as debridement, using the right medications, and most importantly, addressing the root cause, poor blood circulation. In this guide, we will help you understand every essential aspect of venous ulcer care. You will learn how to recognize the symptoms, choose safe treatment methods, and avoid common mistakes that can worsen the condition. Whether you are caring for yourself or for a loved one, knowing these principles will ensure a faster and safer healing process. Venous ulcers are a type of chronic wound that primarily occur on the lower legs, often around the ankles. They develop due to prolonged venous insufficiency, a condition where the veins in the legs are unable to effectively return blood to the heart. Over time, this poor circulation leads to increased pressure in the veins, causing them to weaken. As pressure builds, fluid begins to leak out of the veins and damage the surrounding tissues, eventually leading to an open wound that is slow to heal. Several factors can increase the risk of developing venous ulcers. Chronic venous insufficiency is the most common cause, but other conditions can also contribute. A history of deep vein thrombosis, DVT, which can cause permanent damage to the veins, is a significant risk factor. A sedentary lifestyle, where individuals spend long periods sitting or standing without movement, also slows circulation and increases risk. Obesity places extra pressure on the veins, making it harder for blood to return to the heart. Genetics can also play a role, as some people are born with weaker vein valves, making them more susceptible to venous insufficiency and the resulting ulcers. Understanding how venous ulcers differ from other types of ulcers is critical for proper treatment. Venous ulcers typically have irregular jagged edges and a reddish base due to the presence of granulation tissue, which is part of the healing process. They may also contain yellowish fibrin, a protein that can slow healing if it accumulates, and black necrotic tissue, which indicates dead tissue that must be removed. These ulcers are usually not very painful unless they become infected. In contrast, arterial ulcers are caused by poor blood supply to an area due to blocked or narrowed arteries. These ulcers have well-defined, clear edges and are often dry, with a pale or blackened base. They are usually very painful because the lack of blood supply means the affected tissue is essentially starving for oxygen. Diabetic ulcers are another type of chronic wound that commonly occur on the feet. These ulcers are the result of poor blood circulation combined with nerve damage, neuropathy, which reduces sensation. Because of this, many individuals with diabetic ulcers may not feel pain, allowing the wound to worsen without their awareness. If venous ulcers are not properly treated, they can lead to serious complications. Infection is a common issue, as the open wound provides a pathway for bacteria to enter. An infected ulcer may become red, swollen, warm, and produce pus with a foul odor. In severe cases, the infection can spread to the surrounding tissues, leading to cellulitis, or even enter the bloodstream, causing sepsis, a life-threatening condition. Untreated venous ulcers can also lead to necrosis, where tissue dies due to poor blood supply. This can result in gangrene, which may require amputation if not managed promptly. Additionally, chronic pain and reduced mobility are common in individuals with untreated venous ulcers, severely impacting their quality of life. The significance of venous ulcers cannot be overstated. According to the American College of Phlebology, venous ulcers account for more than 70% of all chronic wounds in older adults. This high prevalence highlights the importance of early recognition and proper management. The aging population in the United States is at an increased risk, making it crucial for seniors and their caregivers to understand the nature of venous ulcers, recognize the symptoms, and seek appropriate care. In summary, venous ulcers are not just simple wounds, they are a clear indication of poor blood circulation, and without the right treatment, they can become a gateway to severe health complications. But with proper care, they can heal, and the risk of recurrence can be minimized. Recognizing and accurately assessing venous ulcers is crucial for effective treatment. These ulcers typically appear on the lower legs, often around the ankles, and are characterized by irregular edges, a reddish base, and sometimes a yellowish layer of fibrin or black necrotic tissue. Unlike many other wounds, venous ulcers do not usually cause severe pain unless an infection develops. However, they may become swollen, reddish, and may ooze fluid. In some cases, an unpleasant odor may also be present, indicating a more serious issue. One of the key challenges in managing venous ulcers is distinguishing between a simple bacterial colonization and an active infection. The human skin naturally harbors bacteria, which can colonize the wound surface without causing harm. This is known as colonization. It is entirely normal and does not require treatment. However, an infection occurs when bacteria penetrate the tissues, triggering the body's immune response. Infected venous ulcers are often characterized by noticeable redness, warmth, increased swelling, and the presence of pus. The wound may become more painful, and a strong, foul smell may develop. In severe cases, fever and chills may also accompany the infection, indicating that it has begun to spread beyond the wound site. Knowing when to seek medical attention is critical for anyone dealing with venous ulcers. Generally, if a venous ulcer does not show significant signs of healing within 2 weeks despite proper home care, it is time to consult a healthcare provider. Additionally, immediate medical attention is necessary if signs of infection appear, such as increased redness, swelling, intense pain, warmth around the wound, or a foul-smelling discharge. In the United States, seeking help from specialized wound care centers is highly recommended. These centers have trained professionals who can perform advanced assessments and treatments, ensuring that the wound is managed properly from the start. One of the most reliable methods for evaluating venous ulcers is the use of a Doppler ultrasound. This non-invasive test measures blood flow in the veins, helping to determine whether the venous insufficiency is due to blocked veins, damaged vein valves, or other underlying issues. Doppler assessment is particularly valuable because it can guide treatment decisions. For example, if severe venous reflux is identified, the healthcare provider may recommend compression therapy, medication, or even surgical interventions. In the United States, many seniors can access specialized wound care through Medicare or private insurance plans, which often cover the cost of Doppler evaluations and wound care consultations. In addition to wound care centers, many hospitals and clinics offer similar services, ensuring that seniors have access to high-quality care. Unfortunately, a common mistake among individuals with venous ulcers is attempting to self-treat without proper guidance. This may include using over-the-counter antibiotic ointments, which are often ineffective for deep infections, and may even promote antibiotic resistance if misused. It is important to understand that not all wounds require antibiotics. Only wounds showing clear signs of infection should be treated with antibiotics, and this decision should always be made by a healthcare professional. Another common error is relying solely on home remedies or unverified online advice. For example,
Applying herbal oils, homemade pastes, or using harsh antiseptics can actually damage the tissue and delay healing. Even well-meaning advice from friends or family may lead to improper care if it is not based on medical knowledge. This is why a proper evaluation and guidance from a healthcare provider are essential. Understanding these basic principles of detecting and assessing venous ulcers can significantly improve outcomes for those affected. Proper identification, timely evaluation, and avoiding common mistakes can prevent complications and promote faster healing.
Proper cleaning and care are the foundations of effective venous ulcer management. Regular and thorough wound cleaning is essential to prevent infection and promote healing. The most recommended method for cleaning venous ulcers is using a saline solution or clean running water. According to the Centers for Disease Control and Prevention, CDC, saline solution is the safest option because it is gentle on the tissue while effectively removing dirt and bacteria. For those without saline, clean running water can also be used, but it should be free of any contaminants. It is important to avoid using strong antiseptic solutions, such as hydrogen peroxide, iodine, or alcohol, unless specifically instructed by a healthcare provider. These harsh solutions can damage healthy tissue, slowing down the healing process. In many cases, they kill not only harmful bacteria, but also the cells necessary for wound repair. Only use antiseptics when prescribed by a doctor, and always follow their instructions carefully. One of the most critical aspects of caring for venous ulcers is the process known as debridement, which means removing dead or damaged tissue from the wound. Debridement is essential because dead tissue can become a breeding ground for bacteria, increasing the risk of infection. There are three main types of debridement that can be used, depending on the condition of the wound. The first method is chemical debridement, which involves applying specialized creams or ointments, such as medihoney or Silvadene. Medihoney, a type of medical-grade honey, has natural antibacterial properties and helps maintain a moist environment, which promotes healing. Silvadene, on the other hand, is a silver-based cream that effectively fights bacterial infections while soothing the wound. These creams should be applied as directed by a healthcare provider, typically once or twice a day. The second method is mechanical debridement. This involves using gentle water pressure to wash away dead tissue. For venous ulcers, this can be done using a soft showerhead or a saline spray bottle. The water should be applied gently, avoiding excessive force that could damage healthy tissue. Mechanical debridement is a simple and effective method that can be done at home, but it should always be done with clean hands and clean equipment to avoid introducing bacteria into the wound. The third and most advanced method is surgical debridement. This is performed by a healthcare professional, usually at a wound care center or a hospital. During surgical debridement, a doctor uses sterile instruments to carefully remove dead tissue, ensuring that only non-viable tissue is removed. This method is often necessary for severe ulcers with extensive dead tissue or signs of deep infection. Surgical debridement is performed under local anesthesia to ensure patient comfort, and it is one of the most effective ways to clean a wound thoroughly. After cleaning and debridement, the next crucial step is protecting the wound to promote healing. This is done using a non-stick dressing, which prevents the bandage from sticking to the wound and causing further damage. For best results, choose dressings designed for wound care, such as hydrocolloid or foam dressings, which maintain a moist environment that speeds up healing. For those at high risk of infection, antimicrobial dressings containing silver or honey may be recommended. These dressings help prevent bacterial growth without harming healthy tissue. When applying a dressing, it is essential to ensure that it is secure, but not too tight. Excessive pressure can restrict blood flow, slowing down the healing process and potentially worsening the ulcer. The bandage should be wrapped gently, and any adhesive tape should be applied to the dressing itself rather than directly on the skin, which can be fragile. Regularly changing the dressing, at least once a day, or as directed by a healthcare provider, is also important to keep the wound clean. Despite these best practices, there are several common mistakes that must be avoided when caring for venous ulcers. The first is neglecting regular cleaning, which can lead to the buildup of bacteria and infection. The second is failing to remove dead tissue, allowing it to accumulate and prevent healing. Another frequent mistake is wrapping the bandage too tightly, which can restrict blood flow to the area and delay recovery. Finally, using strong antiseptics without medical supervision can damage healthy tissue and worsen the condition. Caring for venous ulcers requires consistent attention and a clear understanding of best practices. By following safe and effective cleaning techniques, choosing the right debridement method, and using appropriate dressings, it is possible to promote healing and reduce the risk of complications. For those with persistent or severe ulcers, seeking professional help from a wound care center is always the best choice. Compression stockings are one of the most effective tools for managing venous ulcers and promoting healthy blood circulation. These specially designed stockings apply gentle pressure to the legs, which helps push blood back toward the heart, preventing it from pooling in the lower legs. This improved circulation reduces swelling, alleviates discomfort, and significantly lowers the risk of new venous ulcers forming. Studies show that consistent use of compression stockings can prevent ulcer recurrence by up to 60%, making them an essential part of long-term care for those with chronic venous insufficiency. Choosing the right compression stockings is critical for their effectiveness. The most commonly recommended compression level for venous ulcers is between 20–30 mmHg, which provides enough pressure to support circulation without being too tight. However, this may vary depending on individual conditions, so it is always best to consult a healthcare provider before purchasing. Compression stockings should be worn in the morning when the legs are least swollen. This is because swelling tends to increase throughout the day, making it harder to put on the stockings later. It is also essential to ensure that the stockings fit properly. They should be snug, but not painfully tight. Compression stockings that are too tight can restrict blood flow, leading to discomfort, tingling, or even more severe problems, like loss of circulation. On the other hand, stockings that are too loose will not provide the necessary support. Modern compression stockings are available in a variety of styles, including knee-high, thigh-high, and full-length, allowing individuals to choose the type that best suits their needs. However, there are certain individuals who should avoid using compression stockings without medical advice. Those with peripheral arterial disease, PAD, should never use compression stockings without first consulting a doctor, as the added pressure can worsen circulation problems. Signs of PAD include cold feet, pale or bluish skin, and pain in the legs, even at rest. Additionally, if a person experiences pain, tingling, or numbness while wearing the stockings, they should be removed immediately, and medical advice should be sought. In addition to using compression stockings, there are several other supportive measures that can enhance blood flow and promote healing for venous ulcers. Elevating the legs when resting is one of the simplest and most effective methods. This position helps blood return to the heart, reducing pressure in the veins of the lower legs. For best results, the legs should be elevated above the level of the heart for at least 15–30 minutes, 2 to 3 times a day. Using pillows or a recliner with leg support can make this practice easier and more comfortable. Regular gentle exercise, such as walking, can also support circulation. Movement activates the calf muscles, which act as a natural pump to help blood flow upward. Seniors who are physically able should aim for light, regular physical activity as part of their daily routine. For those who find it difficult to stay active, even simple ankle rotations, while sitting or lying down, can help maintain blood flow. For individuals who struggle with managing venous ulcers at home, professional home care services may be a valuable option. Many home health agencies in the United States offer specialized wound care where trained nurses visit the home, clean the wound, change dressings, and ensure that the compression stockings are applied correctly. These services can be covered by Medicare or private insurance, making them accessible to many seniors. Proper use of compression stockings and the adoption of other supportive practices can significantly improve outcomes for those with venous ulcers. These methods do not just promote healing but also help prevent future ulcers from developing.
By maintaining good blood circulation and following a comprehensive care plan, individuals can reduce their risk of complications and maintain healthier legs.
When it comes to treating venous ulcers, many common mistakes can significantly slow healing or even worsen the condition. One of the most frequent errors is using medications without proper medical guidance. Applying over-the-counter creams, herbal ointments, or home remedies without understanding their effects can irritate the wound, delay healing, or even cause an allergic reaction. In some cases, using antibiotic creams without a prescription can lead to antibiotic resistance, making future infections harder to treat. Always remember that not all wounds require antibiotics, and these should only be used under the supervision of a healthcare provider. Another major mistake is poor wound hygiene. Some individuals may neglect regular cleaning, assuming that leaving the wound covered without inspection is safer. However, this can lead to bacterial buildup, increasing the risk of infection. Regular cleaning with a saline solution or clean water, as recommended, is essential. Some may also choose to use strong antiseptics like hydrogen peroxide or iodine, without understanding that these solutions can damage healthy tissue and slow healing. Antiseptics should only be used if specifically recommended by a healthcare provider. Improper bandaging is another common issue. Wrapping a bandage too tightly can restrict blood flow, which is already a problem in those with venous ulcers. A tight bandage can cause additional pressure, leading to more tissue damage and slowing the healing process. On the other hand, using a bandage that is too loose or leaving the wound exposed can increase the risk of infection. The best approach is to use a non-stick sterile dressing that is secured gently but firmly, allowing the wound to breathe and heal. Failing to monitor the condition of the ulcer is another frequent mistake. Some individuals may assume that as long as the wound is covered, it will heal on its own. However, without regular inspection, early signs of infection or worsening can be missed. Symptoms like increased redness, swelling, warmth, pus, or a foul smell are clear indications that the ulcer is not healing properly and may be infected. Regularly checking the wound, either personally or with the help of a healthcare provider, is crucial to ensuring timely intervention. To avoid these mistakes, it is essential to always follow the advice of a healthcare professional. Regular consultations, especially with a vascular specialist or wound care nurse, can ensure that the treatment plan is appropriate and effective. Professionals can assess the wound's condition, recommend the right cleaning and dressing methods, and adjust the treatment plan as needed. For individuals with persistent or severe venous ulcers, visiting a specialized wound care center can provide advanced treatments and professional guidance. Consistency is key in venous ulcer care. Keeping the wound clean, using appropriate dressings, ensuring good blood circulation with compression stockings if recommended, and maintaining a balanced diet rich in nutrients to support healing are all critical components of effective care. Regular light exercise, such as walking, can also promote circulation and speed up recovery. For those who are not confident in self-care or have mobility issues, home care services are an excellent option. Many home health agencies in the United States provide specialized wound care services where trained nurses visit patients at home, clean the wound, change dressings, and monitor the healing process. Such services are often covered by Medicare or private insurance, making them accessible to most seniors. In conclusion, venous ulcers are more than just a wound. They are a clear sign of poor blood circulation, which requires proper attention and care. Ignoring them can lead to severe complications, including infections, tissue death, or even amputation in the worst cases. But with the right care and consistent monitoring, they can heal, and the risk of recurrence can be minimized. For anyone dealing with venous ulcers, remember to always consult a healthcare professional, maintain good hygiene, use appropriate dressings, and avoid home remedies or over-the-counter treatments without proper guidance. Healing takes time, but with the right approach, it is absolutely achievable. If you found this information helpful, please like this video, subscribe, and turn on notifications. We regularly share practical health tips to help you stay strong and healthy. Don't miss our future videos. Stay tuned.